Hi, this is Dr. Kingston, and in this video I'll be talking about the innervation of the cheeks, teeth, and gingivae. The objective here is exactly the same as the title. So your cheeks are probably very familiar to you, but anatomically the cheeks are defined as the skin, the buccinator muscle fibers, and the mucosa that make up the lateral wall of the oral cavity. They receive motor innervation for that buccinator muscle from the facial nerve, because it is a muscle of facial expression, and sensory innervation for the skin and mucosa from the buccal nerve, which is a branch of the mandibular nerve in the infratemporal fossa. So here's the mandibular nerve, and we can follow that buccal nerve right down on to the cheek there. The buccinator muscle sits deep to the buccal fat pad, which we see right there. And it is technically a muscle of facial expression that tenses the cheeks. It's innervated by the facial nerve and everything, but you really make use of it when you're eating something. So its position deep within the cheek here allows it to hold the cheek right up against the buccal surface of the teeth. This means that as you're chewing, the food that's being ground up on your molars doesn't slip off and fall into the oral vestibule. And speaking of teeth and chewing, all teeth are going to receive somatic sensory innervation from the trigeminal nerve. The maxillary teeth are innervated by branches of the maxillary division, and the mandibular teeth are innervated by branches of the mandibular division. The innervation of the maxillary teeth is split up among three branches from the maxillary nerve. So here is trigeminal. Here is the maxillary nerve. This first branch here is the posterior superior alveolar, which heads into the maxilla itself, where it's going to travel down to the alveolar process and spread out in a superior dental plexus that's going to send branches to individual teeth. This is going to supply the molars for the maxillary tooth row. Our other two branches here, the middle superior alveolar and the anterior superior alveolar, branch from the infraorbital nerve, which is the terminal extension here of the maxillary nerve. The middle superior alveolar is going to innervate the premolars and the first molar, and the anterior superior alveolar is going to innervate those anterior teeth, the incisors and the canines. Note here that both of these nerves are going to come down into the alveolar process and again spread out into that dental plexus that will then send branches to individual teeth. The mandibular division of trigeminal, so back up here, is going to pass through foramen ovalium into the infratemporal fossa, where it's going to give off a branch called the inferior alveolar nerve. And that is going to travel inferiorly and enter into the mandible through a little hole called the mandibular foramen. It's then going to pass through the bone down into the alveolar process, where it's going to form an inferior dental plexus that will send branches up to individual teeth here. Now, all the mandibular teeth are innervated by the inferior alveolar nerve, but the molars and premolars get innervation specifically from branches named dental branches, and the incisors, the canine, and part of that first premolar are innervated by what are called incisive branches. The main differentiation between the dental branches and the incisive branches is this little guy here, this mental nerve that is going to emerge from the mental foramen out onto the face as a sensory nerve. Anything that comes off before that is a dental branch. Anything that comes off after that has branched here is going to be an incisive nerve. The innervation of the gingivae is slightly more complicated because there's two sides of the gingivae. So we have a buccal side and a lingual side, and these are separated by this tooth row. Now, the solution that your body has to this is that the gingivae share sensory innervation with neighboring structures on either side of the tooth row. So I put together a little chart here to help you remember what structures share innervation with the gingivae. Most gingivae is going to share the innervation of its neighboring mucosa. The only exception to this are the buccal and labial gingivae of the maxilla. So these guys up here. And these are also going to get some innervation from the nerves that serve the teeth that sit right near them. This means that the buccal gingivae for the maxillary molars here comes from both the buccal nerve, so this little branch over here of the mandibular nerve, and the posterior superior alveolar nerve that we saw earlier. All right. The premolars are served both by the infraorbital nerve and the middle superior alveolar nerve, and the canine and incisors are served by the infraorbital nerve and the anterior superior alveolar. Now, the general pattern here is that the maxillary gingivae are innervated by branches of the maxillary division of trigeminal, and the mandibular gingivae are innervated by the mandibular division. So obviously we have a pretty glaring exception to this here with the buccal nerve innervating some of the maxillary gingivae, but in all other regions this pattern will hold. The maxillary lingual gingivae, so lingual is this side over here by the tongue, are all butted up against the hard palate, which is innervated by the greater palatine nerve posterior to the canines and the nasopalatine anterior to them. So both of those are branches of the maxillary nerve. For the mandibular teeth, the buccal nerve again is going to innervate the gingivae lateral to the molars, and for the anterior teeth, it's the mental nerve. The lingual nerve on the lingual gingivae here also innervates the whole of the oral floor mucosa, and so it's just a little jump upward to hit the lingual gingivae here as well. That brings us to the end of our discussion of innervation. So here is your practice question. The answer here is C. You should target the inferior alveolar move for this procedure. Now, this question might have been a little bit tricky. So number one, that inferior first premolar has a split innervation between the dental branches of the inferior alveolar and the incisive branches of the inferior alveolar. But that is not the only reason why the inferior alveolar nerve as a whole is the correct answer here. Remember that these dental branches and incisive branches exist within the alveolar process of the mandible here, so they're actually quite difficult to access. The inferior alveolar nerve, though, the nerve that these all branch from, is much easier to access, especially with an anesthetic. It is going to enter into the mandibular bone here at the mandibular foramen, and the mandibular foramen is very closely associated with this little spike of bone here called the lingula. And this is a palpable structure within your own mouth and within your patient's mouth in the future. So you would direct your needle with anesthetic toward this lingula and anesthetize the inferior alveolar nerve as it enters into the mandible. That is the end. Thank you for watching.